Hi friends, let's have a short talk on the extraintestinal manifestation of the ulcerative colitis. As we know, ulcerative colitis is a disease of the colon, always involving the rectum. So the rectum is the first site of the involvement, and as the disease progresses, as the disease becomes severe, the whole of the colon may be involved. So there are many extraintestinal manifestations of the ulcerative colitis. The most common is the arthritis. Arthritis, usually it is of either of ankle, knees, hip or shoulder joint, and it is found in up to about 20% of the patients. And this episode of the arthritis is more severe whenever the patient has an attack of the ulcerative colitis. So whenever there is an exacerbation of the attack, this manifestation of the arthritis increases. Now coming to the other manifestation are ankylosing spondylitis. Ankylosing spondylitis is a condition where the spine becomes like bamboo, also known as bamboo spine-like appearance, and this is a more commonly seen in those patients who are HLA-B27 positive. The third manifestation is erythema nodosum, which is usually found in up to about 10 to 15% of the patients. Pyoderma gangrenosum. This is found in up to 5 to 6% of the patients, and here what happens in the pre-tibial region, and in the leg there will be a painful plaque which usually ulcerates, and this condition is known as the pyoderma gangrenosum. So these extraintestinal manifestations, namely arthritis, ankylosing spondylitis, pyoderma gangrenosum and erythema nodosum. There is one peculiar feature about these extraintestinal manifestation is that these either improve or totally resolves once the patient undergoes total colectomy for ulcerative colitis. Now there is one other extraintestinal manifestation which does not improve on colectomy, and that is the primary sclerosing cholangitis. Primary sclerosing cholangitis, which it is usually found in males, and it is associated in about 5 to 8% of the ulcerative colitis. Now there is one interesting aspect of PSC and ulcerative colitis, that in those patients who develop primary sclerosing cholangitis, the ulcerative colitis is usually not very aggressive. It is usually mild presentation, but the chances of developing cancer are very high. It is said up to 5 times more chances of patients developing cancer in a patient of ulcerative colitis who has primary sclerosing cholangitis. And this cancer is usually proximal to the splenic flexure. And those patients who are HLA-B8 or HLA-DR3 haplotype positive, they are having more chances of developing primary sclerosing cholangitis. And one more important thing about the primary sclerosing cholangitis in these patients are that even after surgery, even after total colectomy, the primary sclerosing cholangitis does not improve. And the presentation of the primary sclerosing cholangitis can be very mild just by the rise in the alkaline phosphatase, or it may be just like other primary sclerosing cholangitis like obstructive jaundice. And if the patient has developed primary sclerosing cholangitis, if the proper treatment is not given, if the liver transplantation is not done, usually the patients die of liver failure. Thank you.